This is Honorable Ken C.B.A. from Trans Nzoia County, but based in Nairobi. Slightly about myself. I have worked with the county government of Trans Nzoia, the first phase of devolution. I came in as the minister in charge of health in Trans Nzoia County, and we worked very well and aggressively to ensure that devolution takes root. You are all aware that the country has been crumbling with the doctors' strike. Thank God that the government and the union, doctors' union, agreed, and they have now gone back to work. But for the past 56 days that the strike was on, I followed closely what was happening, and some of the emerging issues, the questions that many people are asking themselves. What is it exactly that the doctors are striking for? What do they want? What is it that the government is not doing? On the other hand, the government, through the CS Health, Dr. Nahumicha, they were very, very categorical that they will not be able to move and be able to agree with the doctors' demands. There was the issue of the C.B.A. that was signed in 2017, and the government could not come out clearly, or the union could not come out clearly and explain what exactly was this C.B.A. all about, and what is a C.B.A. in the first place. A C.B.A. is just a collective bargaining agreement that was signed between the government of Uhuru Ruto in 2017 and the doctors' union. And in that agreement, there were quite a number of things that the union and the government agreed that should be implemented. That was supposed to be done in a phase of 4 years. And for your information, there are about 7,000 doctors working in the public space, in government hospitals, in the referrals, spread across the entire county. So we are talking about a huge labor force that has been out there not working for 56 days. So I will want us to explore what were this C.B.A. all about. And the government and the union identified about 19 key issues that they were, discussing, negotiating about. And out of the 19 key issues, 18 of them were be able to agree. The national government and the union of doctors agreed, and that led to the signing of the MOU so that they can be able to return back to work. One of the key issues that the C.B.A. 2017 was all about was the medical insurance of the doctors. Remember, the doctors are working under very difficult circumstances. Remember, during the COVID, there are some of the doctors, during the execution of their work, some of them even fell sick, some of them even died in the line of duty. So one of the articles that was signed through the C.B.A. by the two parties was to ensure that all the doctors and any other medical personnel must be given a medical insurance cover, so that in the event that one of them is sick, they can also be able to seek treatment. Another thing was for the release of doctors for postgraduate studies. Having worked as a CEC Health, there was a big challenge where some of the doctors will report to work, and after a short while, some of them even serving for months, want to go back for their postgraduate studies. So an agreement was hammered in a way that there will be a win-win situation where the county government or the national government releasing a doctor to go for further studies will be able to, to get value for their money and their time. This is one of the things that was signed, the release of the postgraduate for doctors to go and study based on the C.B.A. that was signed. Another thing that, third issue that was signed was the doctors felt that they were understaffed and they needed more personnel. So they signed an MOU so that the national government and the county governments can be able to employ more doctors so that we can have more personnel to be able to serve Kenyans, as opposed to a situation whereby you go to one facility and maybe we have a doctor who is serving many facilities, and in that scenario, effective health service care does not reach the intended personnel. Another thing, the fourth issue that the doctors wanted was they also wanted to have an access to the car and mortgage facility. Remember, the national government and the county government, especially the executives at the county, they have a car and mortgage facility where the governor and his deputy and the ministers and the county assembly members have access to a car and mortgage facility. So in order to motivate the doctors, they felt that they should also be given a chance to be able to access the car and mortgage facility, which is in itself is a good thing, because the doctors sometimes respond to emergencies even at night. The doctors sometimes respond to emergencies even when they're off duty. So for them to be able to access the place of work, they needed to be mobile. They also needed a mortgage facility so that they can have even a house to be able to, operate better and be comfortable to over their work. The fifth thing that the government has been negotiating about with the doctors was to signing a new C.B.A. You remember some of these counties went ahead and signed their own C.B.A. with the respective union of doctors in their respective counties. But now the government has agreed with the doctors union that now each county can now go ahead and negotiate some areas that we think have not been addressed, so that within 90 days they should have been able to finalize the new C.B.A. that will now be able to bind the respective doctors in those counties and the county governments. Another thing that the doctors were really agitating and they really were pushing the government to honor was the arrears of their basic salaries. Remember, the 2017 C.B.A. agreed that the salaries for doctors should be enhanced, should be increased, but to date nothing had happened. And that necessitated the doctors to call for this strike. So, in other words, the national government and the doctors' union have agreed in principle that through treasury funds can now be released so that the respective counties and even the national government can be able to honor their arrears and be able to pay for the doctors. Another thing that was at the core of the discussion in this C.B.A. 2017 was the remittance of the statutory deductions. Remember, the doctors, while they are working, they have statutory deductions that are normally deducted from their salaries. Money for cooperatives, maybe some of them are in circles, the monies are deducted, some of the money for KRA. But unfortunately, when I was working at the county as the CEC Finance, I discovered that some of those monies are never remitted to respective agencies. And at the end of the day, you realize that some of these officers become victims. Some of them, KRA ends up, even attaching their accounts, and they cannot be able to access their account because they have an accumulated arrears of some of these non-remittance of those deductions. So the union and the government have now agreed that all those deductions that were not remitted should be remitted with immediate effect, so that doctors are not disadvantaged. There is also an issue that these doctors were agitating for. Some of the doctors have stagnated. There are no promotions, there are no redesignations from one job group to the other, and therefore, in principle, they have now agreed that counties can now go back to their respective counties and be able to liaise with the county public service boards of those counties and be able to promote the doctors who are due for promotion with immediate effect. Another challenge that the counties and the doctors have been able to experience is harmonization of their terms of service. You will find that a doctor working in Bungoma County and another doctor working in Kariza County, they're in the same job group, but a doctor working in Bungoma could be earning more than a doctor working in Kariza or vice versa. Or in terms of even the allowances that are being given, you'll find a doctor in Kariza being given a risk allowance and a hardship allowance, but a doctor in Bungoma maybe is not being given the risk allowance. So they have, the union and the government have now agreed that those terms of service must be harmonized so that we have uniformity in terms of the remuneration, uniformity in terms of the rankings, even across the entire board of the civil service in the county and also in the national counties. So we had an issue of some counties that had challenges, like Grinyaka and Nairobi County had a running issue with their doctors. And one of the things that they have agreed is that the two counties can go back to their respective counties. The union and the county government have been directed now to be able to iron out those gaps and challenges so that in the next 30 days they should have finalized, have a proper working engagement so that each and every party is now happy. Is a win-win situation for each one of them. Then one of the clauses that was worked on closely was the return to work formula. Realized that there are some counties even who had gone ahead to write letters of dismissal to the doctors. And one of the arguments was that as they return back to work, any victimization or any disciplinary action that had been taken against these doctors is now null and void. It is no longer going to work, and this should be effected within 24 hours. And my intelligence and my cross-check across the entire country is that most of the places, the healthcare system is now back to work, doctors are back to work, and they're now working. There was another issue of non-victimization, that nobody who has been involved in the doctor strike should be victimized by any of the agencies, whether it's the national government, whether it is the county government, respective county government, so that people can be able to go back and be able to work. And I remember there was one of the things that was really in this MOU was that there must be matters that are before court. You remember there are one of the key issues that the doctors were striking for. In fact, one of the things that made the doctors to go on strike was the employment of Indian doctors. And this is a matter that was not finalized. Out of the 19 issues, 18 were finalized. So there is one key issue that has not been finalized, and the matter is now in court. And they have been directed that within 60 days, they should have been able to finalize this matter so that these Indian doctors can now be posted and their remuneration can now be paid fully so that these doctors can be able to go and work, be able to finish, be able to be admitted to be full doctors. But there is something that I'll want to put across. There is something that I want to put across. One of the things that I want to let Kenyans know is that, are we out of the woods? Are we safe as a country? Does it mean that now the end of this strike marks the beginning or a new dawn in the healthcare system? Have we handled the issues that made the doctors go to strike? Have we handled the challenges that have been there in the health sector? And my biggest worry is that We may be going back to the old system where we discuss, we sign a work to return formula, then thereafter we do not have a mechanism to follow up to ensure that the issues that were raised are addressed in full. For example, one of the things that I discovered while working at the CEC of Health in the county is that health is underfunded. And as long as we have a healthcare system that is underfunded, where we cannot be able to provide enough drugs to hospitals, we cannot be able to employ more doctors, we cannot be able to employ more health personnel, we cannot be able to improve on our infrastructure, both at the county and the national level, we will still be going back to the same song where you walk into a health facility, you do not find enough drugs, you do not find enough commodities, you do not find enough personnel who are working there. So I really want to challenge both the national government and the county government that a time has come where we have to be sincere, come together on a round table, and be able to be open-minded and discuss the actual issues that have been affecting health. Remember, health is almost 75% devolved. The national government have only a few roles. That is provision of implementation of some health policies and so forth, setting medical service policy, providing both curative healthcare services, and also to manage healthcare policies and administration. But you see, the bulk of the money is left at Afya House. Remember, only 15% of the money released to the Ministry of Health is divided among the 47 counties, and 85% is left at the national government. And yet, the bulk of the healthcare services are devolved. So I want to challenge the two levels of government to sit together and be able to candidly discuss whether we have to move health to higher levels where each one of us can be able to move into a public health facility and feel that you have been attended to satisfactorily as by the laid down international standards. And my closing remark is this: as long as the political class of this country cannot be able to use the public health facility, either with the insurance that is paid by the public funds, walk into a public hospital and be able to be admitted there, be able to be served there. Because you realize that right from the president, the deputy president, the ministers, the members of parliament, the senators, and even the MCAs, they all have a medical insurance cover. But do you know what happens? They would rather go to Nairobi Hospital, Mata Hospital, Aga Khan Hospital, but you will rarely find that an MP has gone to Kenyatta National Hospital for service. You will rarely find out that a governor has been admitted in a county referral hospital. So as long as our political class cannot be able to trust their own system and prefer to go to private hospitals or even fly to other countries for medical attention, health will always suffer the challenge of non-attention and not being given priority in a country of Kenya where most people really are suffering because they have no medical cover, they have no money for treatment, they basically are surviving. Most of the people during the strike died. Unfortunately, we may never be given these statistics because that will be a minus to the government of the day. So on this few remarks, I say that we have a chance to make Kenya a great nation and improve our healthcare system. Thank you.